Timely and effective first aid relieves pain, counteracts shock and prevents further injury, but it can also be the difference between life and death. Preserve life, prevent worsening, promote recovery. These are always your priorities. First aid is defined as the emergency treatment given to the ill or injured before more experienced medical personnel arrive. It is given to counteract shock, to relieve pain, and to prevent further injury or death. Certain conditions require immediate treatment if the patient is to survive. In cases of severe bleeding or asphyxiation, a few seconds delay might mean the difference between life and death. However, the treatment of most injuries or other medical emergencies may be safely postponed for a few minutes to locate a more skilled first aider or suitable medical equipment. From a new trainee to the master, all crew members should be prepared to administer first aid. You must have sufficient knowledge to be able to apply emergency measures and make conscious decisions on whether treatment can be safely delayed until a more capable person arrives. If you are ever called upon to deliver first aid, it's important to know what you need to prioritize. You can do this by remembering the 3 Ps of effective first aid. Your first priority is always to preserve life. If a casualty is in immediate danger, it's a life over limb situation. Opening an airway or performing CPR is far more urgent than immobilizing a broken arm. When necessary, you must work to save their life. In some cases, this might mean moving a casualty with a spinal injury, even though it might cause more damage. You must also remember that preserving life includes your own, so you should never put yourself or others at risk. The second principle is to prevent worsening. Unless the casualty's life is at stake, this means you should not do anything that might make their injuries or the overall situation worse. Rushing into an enclosed space without checking the atmosphere inside is likely to add another casualty. Don't let this be you. Promoting recovery is the third principle. This means you should offer the correct treatment for whatever condition you find the person in. You can also promote recovery by arranging prompt emergency help. Simple first aid can significantly affect the long-term recovery of an injury. Quickly washing a burn under cold water will reduce the risk of long-term scarring and will encourage early healing. As a first aider, you have certain responsibilities when arriving at the scene of a medical emergency. The first thing to do is assess the situation for any dangers. If it's safe to approach the casualty, diagnose the injury. If there is more than one casualty, you must identify who is in the greatest need for medical attention. Is anyone not breathing? Is anyone bleeding or burnt? The following scenario involves a simulated blast on deck, where the first aider must decide the order of treatment for 5 casualties. In circumstances where there is more than one casualty, you should triage according to A, B, C, D, and E. The first thing to consider is the airway. Upon your arrival at the scene, be mindful of any quiet casualties, as they may have a blocked airway. This is always your first priority. To open an airway, use the head tilt chin lift technique. Place one hand on the forehead, 2 fingers on the point of the chin, and tilt the head back. If necessary, use your fingers to remove any visible obstructions from the patient's mouth and throat. After opening any closed airways, check the casualties for signs of normal breathing by using the look, listen and feel technique for a maximum of 10 seconds. Lower your head over the casualty's face and look down at the chest to check for any rise and fall. Listen for any breathing sounds and bend down to see if you can feel any air on your cheek from the casualty's nose or mouth. If the casualty isn't breathing, attempt to restore circulation by using CPR. If the casualty is breathing, they can be placed in the recovery position while you move to other casualties. Your next priority is circulation, as casualties may go into shock and any major blood loss can be fatal. Next, treat any casualties with disabling injuries. These include injuries such as fractures and burns, which are not usually life-threatening, but require swift attention to prevent worsening. Finally, treat anyone else affected by the incident. This may include those who have sustained minor injuries and anyone else who may have witnessed the event. If you ever arrive at the scene of a medical emergency with more than one casualty, remember A, B, C, D, E to decide the order of treatment. As a first aider, you should stay with the casualty until you are relieved by more experienced personnel. Their condition can change very quickly, and they should not be left alone unless you have no other choice than to go for help.
Okay, I am on my way.
When the designated medical officer arrives, tell them exactly what you found, the extent of any injuries, and any treatment you have given. Be as clear as possible and don't exaggerate or assume anything, as what you say could have an impact on any further treatment. Accidents can happen in the workplace, but with effective first aid, it's possible to make sure they are dealt with as quickly and efficiently as possible. Medical facilities on board vessels vary in size, but most are quite limited. This might simply be a cabin with a trolley bed and cupboards. Other vessels, especially cruise ships, have fully equipped medical areas, complete with doctors and nurses. On your ship, there may be a medic or a medical officer who has had further training and can take responsibility for all medical care on board. This could be anyone from the captain or chief officer to the cook. Your vessel will also carry medical supplies, subject to minimum requirements outlined in the medical regulations of your ship's flag state authority. Typically, the first aid kit consists of medium, large, and extra large sterile bandages for dressing wounds, triangular bandages used to support or elevate upper limb injuries, and medium safety pins, which are used to create slings. Do not use these to fasten bandages, as there is a risk of stabbing the casualty. The kit will also include large-size latex-free disposable gloves, to be used as PPE when treating a casualty. Sterile gauze swabs, to clean wounds or as extra padding. And assorted sized adhesive dressings to cover minor wounds. You will also find sterile eye wash in either 20 or 500 milliliter bottles. These larger bottles are often found on eye wash stations. As the eye wash is only sterile until opened, it is for single use only. If you open a bottle, use all of it or discard any you haven't used, even with larger bottles. There should also be oval-shaped, sterile eye pads for covering eye injuries. These will be attached to a bandage or will have a separate plastic patch to hold the dressing in place. Your ship will also have to have at least one stretcher to be used for casualty transportation. Most ships carry a Neil Robertson stretcher because they are very flexible and ideal for use in enclosed spaces. But your ship might have another type of stretcher, such as a Paraguard, used as an all-round search and rescue stretcher. A spinal board, used to transport casualties with spinal injuries. A scoop stretcher, which splits in half to minimize casualty movement. Or a basket stretcher, designed to meet the most difficult emergency situations. There may also be a variety of immobilization splints and medication on board, including painkillers. If you are unfamiliar with any of these items, take the time to familiarize yourself with the equipment so that you're ready to deliver effective first aid whenever it's required. In order to successfully treat an unresponsive casualty, it's important that you can identify the cause of their unconsciousness. One way to remember all of these is with the word fish-shaped. So, if you remember what fish-shaped stands for: faint, imbalance of heat, shock, head injury, stroke, heart attack, asphyxia, poisons, epilepsy, and diabetes, you should be able to identify the cause of unconsciousness and play your part in potentially saving a casualty's life. The first thing to remember is faint. These are caused by a drop of blood flow to the brain, causing the person to black out temporarily. They generally last no longer than 30 seconds to a minute and don't usually have any long-lasting effects. But be careful, because if the person is unconscious for longer than 2 minutes, it is something other than a simple faint. Unconsciousness can also occur if there is a change in body temperature of only a few degrees, and this can cause an imbalance of heat. If the temperature drops below 35 degrees Celsius, mild hypothermia will occur. As it continues to fall, the casualty will have lowered levels of response from about 33 degrees Celsius, will be unconscious by 30 degrees Celsius, and will appear dead when their temperature drops to 28 degrees Celsius and lower. A hypothermic casualty must always be warmed slowly by around 1 to 2 degrees Celsius an hour before being classed as a non-survivor, which is defined as being warm and dead. But it is not only temperatures decreasing that can cause unconsciousness. If a person's temperature rises above 40 degrees Celsius, it can cause heat stroke, which can be fatal. Hypervolemic shock occurs when there is a loss of fluid from the body, either through bleeding, burns or dehydration caused by severe diarrhea and vomiting. The reduction in fluid from the circulation leads to unconsciousness and possibly death. It can also occur very quickly if major blood vessels are damaged. Head injuries are classified into 3 categories: concussion, skull fracture, and compression. Concussions are minor injuries that occur when someone has had a blow to the head. This causes a short-lived loss of mental function and is seen as the least serious type of brain injury. Skull fractures occur when part of the skull is broken or cracked. There will often be a depression where the injury has occurred, and there will be blood-stained fluid leaking from the nose and ears. The last type of head injury is known as compression. This is a potentially fatal injury that happens when the brain is squashed, either because it has swollen or by bleeding into the skull. As both a concussion and a skull fracture can lead to a compression injury, it's essential that you watch any casualty with a minor head injury for any deterioration in condition for at least 48 hours and report any changes. Strokes occur when the blood supplied to part of the brain is cut off, leading to long-term damage. You can often identify a stroke by performing a FAST test. Check for facial weakness. Has their face fallen on one side? Can they smile? Next, check their arms. Can they hold them there? Then check their speech. Is it slurred, or does it sound unusual? If you see any of these signs, you should get medical help fast. Heart attacks occur when a blood vessel in the heart becomes blocked by a blood clot, causing part of the heart muscle to die. The amount of muscle affected by the heart attack will determine how much damage is done to the cardiac muscles. Anything more than 25% will be fatal. Asphyxia is anything that prevents oxygen entering the bloodstream. There are many potential causes, but the treatment is generally the same. Remove the casualty from the cause, or the cause from the casualty, and try to restore breathing. In the case of choking, which occurs when something gets stuck in the trachea and prevents the passage of air, there may be some difficulty removing the blockage. To treat a choking casualty, you should first try to calm and reassure them. Encourage them to try to cough up the obstruction. If this doesn't work, stand beside the casualty and deliver up to 5 sharp blows between the shoulder blades with the heel of your hand, supporting their upper chest as you do so. Watch to see if the obstruction comes out with each blow, and don't be gentle. If this doesn't work, stand behind the casualty and place your hand flat on their abdomen. Find the approximate location of the belly button with your little finger. Form a fist, and turn your hand so your thumb is against the casualty's body. Reach around with the other hand and grasp your fist. Using sharp inward and upward movements, pull your fists into the casualty's abdomen, watching to see if the obstruction is cleared with each thrust. The amount of force you use should lift the casualty off their feet, and can be repeated up to 5 times. If this is unsuccessful, repeat the cycle of back blows and abdominal thrusts. If you have repeated the cycle 3 times without success, support the casualty down to the floor and prepare to start CPR. Poison can enter the body in 4 ways: inhalation, ingestion, absorption, and injection. It can be caused by drugs, alcohol, smoke, gases, fumes from chemicals, absorption through the skin and eyes, or injection from things such as high-pressure fuel lines. Poison can be corrosive or non-corrosive and must be treated by following MSDS instructions. Epilepsy is one of the reasons why people have major seizures, which are another cause of unconsciousness. They happen when nerve impulses in the brain start to fire off in all directions, causing involuntary movement and muscle spasms. Although epilepsy is rare amongst crew, there are a number of causes of seizures on board, including head injuries. Whatever the cause, it's important that the length of seizures are timed, as they can last anywhere from seconds to hours. You should seek medical advice for any seizure that lasts longer than 10 minutes, as this would be classed as an emergency. Diabetes is an illness that affects the levels of sugar in the blood. Hyperglycemia occurs when levels are too high. Although it is usually a slow process, taking around 48 hours, the casualty can become unconscious if sugar levels are not reduced. They will need insulin to treat this, which would be administered by the medical officer. However, insulin is not generally carried on board, as the dosage must be carefully monitored. Hypoglycemia occurs when sugar levels drop. This is a much quicker cause of unconsciousness, which can occur within a couple of hours. Anyone suffering from this should be given sugary drinks or chocolate to raise their sugar levels. So, if you remember what fish-shaped stands for: faint, imbalance of heat, shock, head injury, stroke, heart attack, asphyxia, poisons, epilepsy, and diabetes, you should be able to identify the cause of unconsciousness and play your part in potentially saving a casualty's life. CPR is an emergency procedure used on casualties suffering from a heart attack or cardiac arrest to preserve the casualty's body for defibrillation. Heart attacks and cardiac arrests normally occur when one of the coronary arteries becomes blocked by a blood clot, preventing oxygen from reaching part of the cardiac muscle. The lack of oxygen causes the muscle to die, forcing the rest of the heart to work harder to keep the supply of oxygen going to the body. Eventually, as the heart rate increases, the contractions become less effective and the heart stops working. When you suspect a heart attack or cardiac arrest has occurred, you must approach the casualty as you would in any emergency first aid circumstance. If there is an AED on board your vessel, it is essential that it is used as quickly as possible. Request that it is brought to your location when you raise the alarm, or ask a fellow crew member to prepare it while you start CPR. With a heart attack, the casualty will be conscious and breathing. They will be able to describe their signs and symptoms, such as crushing pain in the center of the chest, radiating down the arm or into the neck, jaw or shoulder, nausea, vomiting and breathlessness. However, if a cardiac arrest has occurred, the casualty will be unconscious, not breathing, and they will need CPR. Start by opening the casualty's airway. Place one hand on the forehead, 2 fingers on the point of the chin, and tilt the head back. Check for breathing by lowering your head over the casualty's face, looking down on the chest, and using the look, listen, feel technique. If the casualty is not breathing normally, they require CPR. Sometimes the casualty can appear to be breathing, but it is noisy and they may only take a breath once every 10 seconds. This is called agonal breathing and is not normal. If this type of breathing is happening, or if you are in any doubt about it, do CPR. Doing chest compressions means that you are taking over the contraction of the heart. When you compress the chest, You are squeezing the heart between the sternum and the spine, forcing the blood out. To start CPR, place the heel of your hand on the center of the chest, approximately between the nipples, and place the other hand on top, interlinking your fingers. Make sure you are close to the casualty, up on your knees, with your arms straight to make sure you can get the right depth of compression. Push down on the chest to a depth of 5 to 6 centimeters at a rate of 100 to 120 compressions per minute. With a very large or very small casualty, you should compress to 1/3 of the depth of the chest. Start with 30 compressions. This should take about 15 seconds. Open the airway again and deliver 2 rescue breaths by placing your mouth across the casualty's mouth, making sure you have a full seal and breathe out. Only deliver a breath, do not blow. Watch to see if the chest rises when you breathe. If the breath does not get through and there is no movement of the chest, open the airway further and deliver the second breath. If you hear gurgling when you deliver the breaths, the casualty may vomit. This tends to happen if the airway is not open properly, as air is then forced into the stomach where it mixes with the stomach contents and causes vomiting.
If this happens, turn them onto their side so the vomit runs out of the mouth. When they are finished, carry on. As soon as you have delivered 2 breaths, whether successful or not, resume compressions and carry on with the cycle of compressions and breaths. If there are 2 of you, swap the person doing the CPR every 2 minutes, which should be about 8 cycles. Continue until you are exhausted and can't carry on, someone arrives to take over or tells you to stop, or the casualty begins to show signs of recovery.
The routine for CPR is the same for everyone. The only exceptions are with a baby or child, or with a casualty pulled from the water. These casualties will have no oxygen in their blood, so you need to put some in before starting compressions.
Begin with 5 rescue breaths and then go into the 30 compressions, 2 rescue breath cycle. Follow this procedure and you'll have every chance of saving a life.
Before we look at burn injuries, let's quickly talk about the skin, which is the largest organ in the body and part of a number of systems.
Containing the nerve endings that give us our sense of touch, the skin helps to keep unwanted items out of the body, such as bacteria and germs, as well as keeping things inside. It also helps with the regulation of temperature, such as shivering to keep warm or sweating to cool down. There are 3 layers. The outer layer is called the epidermis, and it is made of mainly dead skin cells. Your skin is constantly renewing itself, and new cells are always being produced in the lower layers, which push up and flatten, becoming the top layer. The middle layer is called the dermis, and this is where new cells are made. Most of the nerve endings, hair follicles and smaller blood vessels lie here. The lowest layer is called the subcutaneous layer, and this is the fatty tissue that acts as protection for deeper tissues, such as bone and also larger blood vessels. It also acts as insulation to help maintain your core body temperature.
The depth of a burn is classified by how many layers of skin are damaged. When assessing a burn, there are 5 main points to consider, which we remember as scald.
S stands for size, and there are 2 ways of measuring this. With the 1% rule, the palm of the patient's hand is equivalent to 1% of the body surface area. The other method uses the rule of 9s. This is where the body is divided into areas with the head, the upper and lower front of torso, the upper and lower back of torso, each arm, front of each leg, and back of each leg representing 9%, with the groin accounting for the remaining 1%. C stands for cause. Of the 6 main causes of burns, 4 are more typical. Dry heat includes flame, friction, and hot objects. Wet heat includes hot fat, liquids, and steam. The most common type of radiation is sunburn, and cold burns are caused by such things as refrigerant gases. Electrical and chemical burns are classed as the most serious. Chemicals continue to burn until they are washed away. Take care not to contaminate yourself and spread the chemical by cutting away clothing and washing away from unaffected areas. Electrical burns can affect a casualty's heart and breathing. Take care to ensure your own safety by isolating any power supply or by removing live equipment before approaching. If possible, switch off the current. Otherwise, insulate yourself by using rubber gloves and boots, or a rubber mat. Check for breathing before dealing with the burn. If they are not breathing, give artificial respiration. If the heart has stopped, apply heart compressions. You must also be aware of the possibility of both entry and exit wounds when treating an electrical burn.
The A in scald stands for age, which can impact upon how well the casualty's body responds to burns. A child or elderly person has much thinner skin than an adult, and therefore they will suffer burns from much lower temperatures. As they will also lose body fluids quicker, they go into shock faster.
L stands for location, which is another important factor. Any burns to the face, neck or chest can impact on the airway due to swelling, so you must take care to ensure the airway remains clear. D stands for depth, which is the last thing to consider. The depth of a burn is classified by how many layers of the skin are affected. A superficial burn affects only the top layer of the skin, causing reddening to the burnt area. A partial thickness burn goes through the top layer and into the second layer, causing reddening and blisters. Take care not to burst any intact blisters, as this can lead to more serious complications, such as infection and shock. A full thickness burn goes through all layers of the skin and impacts on deeper tissue, such as bone. Initially, this is the least painful, as all of the nerve endings will be burnt away, but these will require skin grafts to heal. Whether you are dealing with a superficial, partial or full thickness burn, the immediate first aid treatment is the same. Cool the wound using cold water for a minimum of 10 minutes. If chemicals are involved, 20 minutes are required. Remove any jewellery and clothing around the burn, but do not attempt to remove anything that is stuck in the burn. Cover the wound with a non-sticky, non-fluffy dressing. Cling film is ideal, as it protects from infection, covers large areas, is transparent, and it will only stick to itself. With the exception of chemical burns, most wounds can be cooled through it. Lay the cling film over the burn, but do not wrap it as the wound will swell. Observe the casualty for signs of shock.
Burns cause plasma to be lost from the blood, making it much thicker and more difficult for the heart to pump around the body. This means that shock can be a big risk with burns, especially deeper burns or those covering large areas of the body. But with fast and efficient treatment, you can play your part and deliver effective first aid whenever it's needed.
Although there are many different ways to treat fractures, it's highly important to identify when one has actually occurred. A fracture is a broken bone, which may be broken into 2 or more pieces, or it may have a linear crack. If there is a wound at or near the break, this is said to be an open fracture. If the skin remains unbroken, they are described as closed. Fractures can be stable or unstable. It is important to recognize the difference, as moving an unstable fracture can cause further injury.
There are several indications that a bone is probably broken. A heavy blow or other force may have been applied to the body or limb, or the casualty or an observer may have heard the bone break. If so, they might experience intense pain, especially when there is pressure or movement at the site. Swelling will almost always occur immediately, potentially followed by discoloration of the skin. Before we move on to the general treatment of fractures, let's consider some of the more difficult injuries that you may face.
If you suspect a fractured spine or neck, you should immediately support the head and neck to prevent movement. Tell the casualty to lie still, and don't let them move until they are supported on a hard, flat surface. Any careless movement could damage or sever the spinal cord, resulting in permanent paralysis, loss of feeling in the legs, and double incontinence for life. Pelvic fractures can cause potentially life-threatening bleeding into the pelvic and lower abdomen cavities. On discovery of a casualty with a suspected pelvic fracture, start a pulse chart immediately and check for concealed internal bleeding. In the case of one of these injuries, or an open fracture, seek radiomedical advice early, because it may be necessary to evacuate the patient.
Coast Guard, Malaga Coast Guard.
Unless there is immediate danger of any further injury, the patient should not be moved until any bleeding is controlled and all fractures are immobilized by splinting. You should never elevate a limb with an open fracture, as this can cause more damage, such as severing an artery. If it is comfortable, fractures should be supported in the position you found the person. Any bleeding should be dealt with as with any embedded object injury, with rolled bandages on both sides and a dressing over the top. No pressure should be applied over the wound, as this could move the bone and cause more damage.
If it becomes necessary to move an injured limb, due to poor circulation for example,
you should gently move the limb until the pulse returns, and then support it in that position. Open fractures of joints, such as the elbow or knee, should not be manipulated. They should be placed gently into a proper position for splinting, which should only be done by the medical officer.
Maintaining the circulation of blood is essential when treating a casualty who is suffering from a fracture or dislocation.
Check and recheck the circulation by pressing on a nail. When circulation is normal, the nail becomes white when pressed and pink when released. Danger signs include blueness or whiteness of fingers and toes, and coldness or loss of feeling below the injury. Test for this by touching the casualty lightly on their fingers or toes and asking if they can feel anything.
Feel anything?
You must also check for a pulse.
If the limb does not become pink and warm, and you cannot detect a pulse, medical help may be urgently necessary to avoid amputation.
Remember that fractures may cause serious blood loss internally. Look out for signs of shock and treat appropriately. A dislocation is present when a bone has been displaced from its normal position at the joint. With this type of injury, movement is limited, and there is often quite severe pain. This is made worse by attempts to move the joint, which is distorted by the dislocation and swelling.
The evidence for a dislocation is very similar to that of a fracture. And you should also remember that fractures and dislocations can occur together. The first aid for dislocation depends on whether it is closed or open.
If a wound is present near the dislocation, it should be covered to stop bleeding and help prevent infection.
Do not attempt to reduce a dislocation. A fracture may also be present, in which case attempted manipulation can make matters worse.
Movement can be prevented in the affected area with suitable immobilization. Support slings are used for any injury in the arm, including the upper arm, elbow, forearm and wrist. Elevation slings are used for any injury around the arm, including the shoulder, collarbone, hand and fingers, and ribs. Once immobilized, look for impaired circulation and loss of feeling. If these are present and you cannot feel a pulse at the wrist or ankle, move the limb gently into a position in which circulation can return and keep it there.
Look for a change of colour in the fingers or toes, from white or blue to pink, and transport the casualty in the most comfortable position.
This is usually sitting up for an upper limb injury and lying down for lower limb injuries.
Fractures and dislocations can occur in numerous areas around the body, and many of these require treatment that is above the level of elementary first aid training. If in doubt, remember to follow the principles of first aid and wait for more experienced personnel to arrive.
Removing a sick or injured person from the site of an accident is a matter of huge importance, as their life might depend on you making the right arrangements. Unless there's a danger from toxic substances, fires or explosions, do not move the casualty until the suspected fractures have been immobilized and any severe bleeding has stopped.
In the event of a medical emergency, such as a spinal injury, heart condition or severe fracture, you'll need to transport the casualty once you have applied first aid. This may be to the medical room or out on deck to await the arrival of the helicopter for medical evacuation.
If any serious injuries are suspected, the casualty is also likely to be suffering from shock, so be gentle when touching them, offer reassurance, and try to get a clear picture of the nature of the problem. Above all, use common sense.
Whenever there is a serious injury on a vessel, the initial recovery of a casualty will be done with the stretcher on board. Although there are various types available, this will typically be a Neil Robertson stretcher. Made of bamboo slats and covered with canvas, it has a series of straps and buckles that secure the casualty, and it forms a cylindrical shape when fastened.
If there's any vertical lifting to be done, the casualty's arms should be fastened down the outside, as there is a risk of the casualty falling out of the bottom when they are fastened on the inside. As this is a very flexible stretcher, it's ideal for enclosed space rescue. But this flexibility also makes it unsuitable for casualties with suspected spinal injuries, as it offers very little support and bends in the middle. When dealing with a spinal injury, a spinal board would be more appropriate, as it is made of rigid plastic with a series of straps and head blocks to secure the casualty and maintain the alignment of the head, neck and back. Alternatively, you could use a scoop. This is a metal stretcher that splits in half vertically and is sloped in the center. The benefit of a scoop is that each side can be placed alongside the casualty and slid underneath their back, before being reconnected, allowing the casualty to be placed on the stretcher with minimal movement. If any of these stretchers are required, ensure the casualty is placed on with all the straps and buckles firmly fastened before any movement occurs.
Although stretchers should always be used when needed,
there are a number of ways to transport a casualty without one. In the circumstance that a casualty only has minor injuries and is able to support their own weight, you can use the human crutch method. Do this by supporting the casualty's injured side with one arm around the waist and putting their arm around your shoulders to assist them to walk. Alternatively, if you are on your own, you can drag them from the scene, but this should only be done in circumstances when the casualty's life is in immediate danger if they're left where they are, as dragging them could cause further injury. If there are two of you, the casualty can be lifted using the fore and aft carry, which is done by having the first person supporting the upper body, whilst the other person supports the legs. When lifting, always bend at the knees, keep your back straight, and use the major muscles in your buttocks and thighs to push up.
the method you use to transport a casualty is dependent on their injuries. Familiarize yourself with these techniques so that you are prepared to act when needed. But remember, only lift when there is no other option, as moving someone with a spinal injury could do more harm than good.